My name is Elliot Koo, and welcome to the 14th episode of Histo Helpers. I'd like you to take a deep breath because we're going to inhale some knowledge about the respiratory system. Today we will 1. Cover the basic components of the conducting and respiratory portions of the respiratory system. 2. Identify the trachea, bronchi, respiratory bronchioles, alveolar ducts, and alveoli. 3. Differentiate the various alveolar cells. 4. Name the cellular and structural elements that form the blood-air barrier. And 5. We will discuss the vascular supply of lungs and be able to identify the pulmonary artery, pulmonary vein, and the bronchial artery on the basis of location and structure. First, we will look at the conducting airways of the respiratory system. Let's begin at slide 92, which is the nasal septum of a dog stained with H&E. Let us first note the cartilaginous nasal septum seen at the yellow arrow. We can also see bony nasal septum at the black arrow, which stains acidophilic. There are two types of epithelium in the nasal cavity, respiratory epithelium and olfactory epithelium. Both contain ciliated, pseudostratified columnar epithelium. The key difference in distinguishing between these two types of epithelia is that respiratory epithelium has goblet cells, while olfactory epithelium has Bowman's glands. Respiratory epithelium can be seen at the blue arrow, and olfactory epithelium can be seen at the green arrow. We will start by looking at the respiratory epithelium. As I zoom in, please take note of the remarkable abundance of goblet cells, which can be used as an identifying characteristic of respiratory epithelium. The respiratory epithelium is made up of 5 basic cell types, which include ciliated cells, goblet cells, brush cells, small granule cells, and basal cells. You will not need to identify all of these cells, but you should know the cell types that comprise the respiratory epithelium. Goblet cells, seen at the yellow arrows, synthesize and secrete mucus. Ciliated cells are tall columnar cells with cilia that project into the mucus covering the surface of the epithelium, seen at the pointer. Brush cells are receptor cells in the respiratory tract that bear short, blunt microvilli on their apical ends. The basal end of these cells are in contact with afferent nerve fibers. Basal cells, seen at the green arrow, are the stem cells in the deepest layer of the epithelium. Lastly, small granule cells are enteroendocrine cells that secrete polypeptide hormones from their granules. We have now zoomed in on a different portion of the slide to observe the olfactory epithelium. The Bowman's glands of the olfactory epithelium secrete a watery mucus onto the olfactory epithelium and can be seen at the red arrows. They are the identifying feature of the olfactory epithelium. Olfactory epithelium is composed of 4 basic cell types, including olfactory receptor cells, sustentacular cells, basal cells, and brush cells. We begin with the olfactory receptor cells spanning the orange line, which form the deeper layer of cells spanning the thickness of the epithelium. They are bipolar neurons that enter the central nervous system via cranial nerve 1 axons. Next, sustentacular cells, or supporting cells, seen at the gray arrow, form the superficial layer. They are columnar cells that provide mechanical and metabolic support to the olfactory receptor cells. Additionally, they synthesize and secrete odorant-binding proteins. Basal cells are seen at the light blue arrow, forming the deepest layer of the epithelium. They are stem cells from which new olfactory receptor cells and supporting cells differentiate. Lastly, take note that brush cells are also found in olfactory epithelium, as in the respiratory epithelium. Turn your attention to the lamina propria within the nasal septum, which contains a rich vascular network. Again, you can also find the mucus-secreting Bowman's glands here at the red arrows. Don't forget, these structures are the main identifying factor for olfactory epithelium. The bundles of nerve we see here at the purple arrow are the olfactory nerves of cranial nerve 1, which are ensheathed in myelin by Schwann cells. We are now moving down the respiratory tract to slide 94, which is a rotated frontal section of the larynx stained with H&E. To orient you, the epiglottis is seen here at the pink arrow, the false vocal cord further down, and the true vocal cord below that. The hyaline cartilage seen here at the black arrow is the thyroid cartilage. The ventricle is spanned by the red line. It is the space between the false vocal cord here at the green arrow and the true vocal cord here at the yellow arrow. As I zoom in, you can see the vocal ligament at the blue arrow. It is made up of dense, regular connective tissue with elastic fibers. The vocalis muscle at the orange arrow makes up the core of the true vocal cord and is responsible for controlling phonation by generating tension and moderating the rima glottidis. If I zoom further, we can see that the false vocal cord is lined with respiratory epithelium with its ciliated, pseudostratified columnar epithelium and goblet cells. The true vocal cord, on the other hand, is composed of stratified squamous, non-keratinized epithelium. It is extremely important to pay attention to the gradual transition between these two types of epithelium. This epithelial transition is a common location for laryngeal cancer formation. Continuing down the respiratory tract, we are now looking at slide 21, which shows both a cross-section of a trachea at the black arrow and a longitudinal section of the trachea at the pink arrow, both stained with H&E. An important characteristic of the trachea are the C-shaped cartilaginous bands seen here in longitudinal section at the yellow arrows. These bands prevent the trachea from collapsing due to traction forces. Let's zoom in to examine the wall of the trachea, which is composed of 4 layers. First, the mucosa, spanned by the green line, is composed of respiratory epithelium, a thick basement membrane seen at the black arrow, and the lamina propria. The submucosa is spanned by the blue line and contains mucus-secreting glands that facilitate the movement of particles along the respiratory tract. Hyaline cartilage of the tracheal cartilage is seen here spanned by the yellow line, and the adventitia is spanned by the orange line and is composed of connective tissue that adheres the trachea to adjacent structures. Let's take a quick glance at slide 254, which is another section stained with H&E of the trachea indicated by the blue arrow and the adjacent esophagus indicated by the pink arrow. In this slide, we're going to look at the trachealis muscle. The green arrows indicate the smooth muscle fibers of the trachealis muscle that bridge the gap of the C-shaped cartilages. The primary function of the trachealis is to constrict the windpipe, allowing air to be expelled with more force. Slide 255, lung 1, is a cross-section of the lung stained with H&E. Pause and take a deep breath before we look at the champions of the respiratory system, the lungs. Let's familiarize ourselves with some basic lung histology. The trachea bifurcates into 2 primary bronchi, which enter the lung and then branch several times to give rise to smaller secondary and tertiary bronchi. The tertiary bronchi give off bronchioles, which get smaller and divide into terminal bronchioles, which mark the end of the conducting zone of the respiratory system. Terminal bronchioles branch into respiratory bronchioles, then alveolar ducts, then alveolar sacs, and finally alveoli. Now, let's move on to identify all of these structures. All of this spongy-looking material found throughout the slide are the alveoli of the lung in cross-section. A bronchus can be seen at the red arrow. Take note that it is completely encircled by a cartilaginous ring. A bronchiole in longitudinal section is indicated by the blue arrow. Bronchioles are characterized by smooth muscle in their walls and a complete lack of any cartilage. The epithelium of the bronchioles can range from pseudostratified columnar to simple columnar to simple cuboidal. You will also see some club cells among the epithelium, as indicated by the orange arrows. As the number of ciliated cells decrease, the number of Clara cells increase. Clara cells, or more appropriately named club cells, are dome-shaped apical cells that secrete glycosaminoglycans which help protect the bronchial lining. They also secrete lipoprotein called surface active agent that prevents luminal adhesion in the event that the airways collapse. Lastly, the club cells also secrete club cell secretory protein, or CC16. CC16 is utilized as a pulmonary marker for bronchoalveolar lavage fluid. Thus, when the lung is injured, the secretions of CC16 into the bronchial tree will decrease, while serum levels of CC16 will increase due to damage to the blood-air barrier. We are now looking at slide 255, lung 2, which is another section of the lung stained with H&E. If you zoom in, You can see a terminal bronchiole by the green arrow that is branching into a respiratory bronchiole, indicated by the blue arrow. Notice that neither of these structures contain cartilage, and both contain smooth muscle in their walls. The respiratory bronchiole differs from the terminal bronchiole in that it contains alveoli budding off from its walls, and therefore it is the first structure to participate in gas exchange in the lung. We've quickly turned to slide 255, lung 3, to show a respiratory bronchiole transitioning into an alveolar sac. Again, notice that the respiratory bronchiole with a beautiful alveolus budding off from its lumen. After air flows through the respiratory bronchiole, it will then move into the alveolar duct, seen here at the pointer with alveoli in its walls. The transition between the respiratory bronchiole and alveolar duct is indicated by the blue line. The walls of the alveolar duct are composed entirely of alveoli, with some smooth muscle, collagen, and elastic fibers surrounding. Air will then make its way to the alveolar sac, which is a distended space seen below the green line. It is surrounded by clusters of alveoli seen at the red arrows. Alveoli increase the amount of surface area, making gas exchange much more efficient. Let's look back at slide 155, lung 2. Here we can see another great example of alveolar ducts giving off several alveolar sacs, with the transition point indicated by the green lines. As I zoom in on the walls of an alveolus, take note of two specific alveolar cell types. About 95% of the alveolar surface is lined with type 1 pneumocytes, as seen here at the teal arrows. These flattened postmitotic cells with abundant cytoplasm are the predominant cells carrying out gas exchange. They attach to each other by tight junctions, forming a barrier between the alveoli and septal wall of connective tissue. When you look at an electron micrograph of the blood-air barrier, you should note its components starting from the blood side: endothelium of the pulmonary vessels, basal lamina, and then finally the alveolar epithelium. Type 2 pneumocytes, seen here at the tip of the orange arrow, are rounder cells that cover much less surface area than type 1 pneumocytes. They also act as stem cells for both type 1 and type 2 pneumocytes. Their primary function is to produce and secrete surfactant, which decreases surface tension, thereby preventing the collapse and adhesion of alveoli. Surfactant production during gestation is extremely important for normal breathing post-parturition. The presence of surfactant helps prevent infant respiratory distress syndrome, which is caused by decreased or absent production of surfactant. Alveoli are surrounded by an abundant network of capillaries, allowing for efficient gas exchange. A capillary can be seen at the tip of the red arrow. Lastly, we've got a couple of dust cells, also known as alveolar macrophages, with their black carbon particulates circled in purple. This is slide 362, which is yet another cross-section of a lung stained with H&E. We're going to bring in our resident expert to discuss pulmonary vasculature. Raheem, can I get a drum roll, please?
As we look at the vasculature of this section of a lung, let's locate the thin-walled elastic pulmonary artery seen here at the purple arrow. This artery carries deoxygenated blood from the right ventricle to the lungs and experiences a low blood pressure ranging from 9 to 18 millimeters mercury. It is running parallel to a cartilaginous bronchus next to the red arrow and the bronchiole next to the green arrow. The bronchial artery is indicated by the blue arrow. It supplies the parenchyma of the lung with oxygenated blood and runs close to the bronchus and bronchiole. Lastly, you can see a tributary of the pulmonary vein, seen here at the orange arrow, traveling at a distance from the bronchi and bronchioles and carrying oxygenated blood back to the left atrium of the heart.
Let's take a quick look at slide 361, which is yet another section of lung stained with H&E. As I move to the lower section of the slide, we can see the numerous lymphocyte aggregates known as bronchus-associated lymphoid tissue, or BALT, here at the red arrow. Let me quickly simplify this concept for you. Please note that BALT is an example of malt, and that GALT is also an example of malt. However, BALT is not the same as GALT, so to sum things up, GALT and BALT are malt, but BALT is not GALT.
Huh?
Finally, we are looking at slide 399, which is a section of lung with orange fusion stain. We can see elastic fibers within the large blood vessels, the walls of the alveolar ducts, and the alveolar sacs. Elastic fibers are part of the structural framework of the lungs and provide the elastic recoil, a very important intrinsic function of the lungs necessary for passive expiration. Degradation of these elastic fibers is an important cause of COPD, such as emphysema, which compromises lung function. Thanks for tuning in to this episode of Histo Helpers. Stay tuned next time as you tinkle through the urinary system with Patho Joe Nadler. As always, we're here to help.
We're here to help.